You're all
Thank you.
set. You can go live now.
Good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is an initiative by Dr. Krishnamani to spread awareness about cancer and help the caregivers and patients to access the right treatment on the right time. Dr. Krishnamani has more than 10 years of experience in oncology therapy, and he has done his DM oncology from the most prestigious institute of Telugu states, that is none other than Nizam Institute of Medical Science, also known as NIMS. At present, he is practicing at American Oncology Institute, Hyderabad. As you all aware, September is known as Ovarian Cancer Awareness Month. Ovarian cancer is the fifth leading cause of death in women worldwide, and it is also called as a silent killer. Today, to enlighten more about ovarian cancer to us, Dr. Krishnamani is with us. If you have any questions and doubts, you may type it in the message box shown below. If at all your question is not answered today in this session, don't worry. We will call you back and we will discuss to you on the question what you have raised in this platform. So please don't forget to share your number in the chat. Over to Dr. Krishnamani here. Doctor, today, as a common man, we have many doubts and questions in our mind. So I have come up with a 10 questions list with me. I request you to please bear with us and request you to enlighten us on those questions and doubt what we have. In between, if anybody raise a question or doubt, we can attend that in between the meeting. Thank you very much, sir, accepting our request. So we request you to please give your opening remarks for this session.
So, good evening, everyone, and at the outset, thank you. As already discussed, Cancer Reach is basically an initiative by us to spread awareness about cancer. So, the whole point of Cancer Reach is we want the knowledge of cancer to spread to as many lay people as possible, so that people are aware, people can detect early, people can stop certain harmful habits in the form of tobacco or smoking or alcohol. They can adopt good lifestyle measures, proper screening techniques. So that way they can avoid many of the cancers which we commonly see. So that's the whole goal of Cancer Reach, which is to educate people and empower people regarding knowledge about cancer. And coming to today, the whole gist of the talk today is an introduction on ovarian cancer, basically, which, as you rightly pointed out, is a silent killer. Ovarian cancer is one of the most common cancers we see in women. In fact, it's the second most common cancer we see in women, gynecological cancer we see in women, and it is responsible for a large number of cancer deaths worldwide, including our country. And gone are the days where we used to say that ovarian cancer is only seen in elderly women. We do see a lot of young women nowadays who develop ovarian cancer. And unfortunately, it is still a deadly disease. Unfortunately, it's still seen in an advanced stage. And unfortunately, we do not have effective screening methods for ovarian cancer to detect it early, like the way we have for, say, a breast cancer or, say, a cervical cancer. So that's the whole agenda for today, that we would like to discuss a few points on ovarian cancer so that all of us are more knowledgeable after this meeting.
Thank you, doctor. Thank you very much for your opening remarks. So while entering into the questions, my first question, doctor, what is actually an ovarian cancer? What does it mean actually?
So ovaries are a set of organs or a pair of organs. They are called the reproductive organs. So the ovaries, the uterus, the fallopian tubes, this is an entire set of reproductive organs. So any cancer which comes in the ovaries is basically an ovarian cancer. Now, the commonest ovarian cancer, which we talk in layman terms, whatever we call as ovarian cancer, is an epithelial ovarian cancer. There is a good variety of ovarian cancer too, which is called a germ cell tumor, which is having a good prognosis, which is where the survival rates are excellent. But that is not what we are going to discuss today. We are going to discuss about the more common layman use the terminology of ovarian cancer is the epithelial ovarian cancer. So basically there are two types. an epithelial ovarian cancer, which is aggressive, which has a bad prognosis, and a germ cell tumor, which is rare, which is seen in lesser number of people compared to an epithelial ovarian cancer, which has a good prognosis, a good biology, seen in younger women, and these patients do well. But today we'll stick to the common ovarian cancer, which is epithelial ovarian cancer. So to keep it very simple, a cancer which develops in the ovaries is the ovarian cancer, and we are talking about an epithelial ovarian cancer. And the epithelial ovarian cancer is usually a cancer which is seen in elderly women, usually post 50s. And these patients have a wide variety of symptoms, which we'll discuss in due course.
Thank you, doctor. Thank you very much. So what are the risk factors of this ovarian cancer?
So as I just told you, increasing age is one of the most important risk factors. Infertility is an important risk factor. There are some people who have ovarian cancer in their families. These people have a mutation called BRCA1 or BRCA2, or we call it BRCA1 or BRCA2. So women who have these mutations in them, or have a risk of breast cancer or ovarian cancer or fallopian tube cancer, pancreatic cancer, in men prostate cancer, etc. Also, there is a set of mutations called uh, Lynch syndrome. There are people who have a familial problem which is called a Lynch syndrome. These people are at risk for ovarian cancer. So the risk factors are like rising age, infertility, and patients with BRCA mutations or Lynch syndrome mutations where many family members are affected. On the contrary, breastfeeding, use of oral contraceptives, intrauterine devices has a protective effect, studies wise, in preventing ovarian cancer.
Thank you, doctor. Thank you very much. Because you have spotted one question, one statement here, genetic mutations. There is a question from Dr. Mitra, who is attending this live session. She have a question here. Do you have any screening programs for ovarian cancer for people who are at risk or people who have family history? That is a question from Dr. Mitra.
So screening is basically a test. What we should understand is what is screening. Screening is a test which is commonly done in the general population to identify a disease. Okay. So when you're doing a screening test in a general population, the test should be effective. That is, it should pick up a good number of cases. It should be simple test. It cannot be a very hi-fi test. It should be done even in the field, in the village. It should be a very reliable test. That is, it should be reproducible. Wherever you do this test, you should get the same kind of results. It is not that in a lab you will get a good result, but in a good lab you'll get a good result, or in the city, or if you go to a tier 2 city you may not get. So it should be simple, it should be inexpensive, it should be reliable, it should be reproducible, and you should be able to find a large number of cases. Then only a screening test is applicable. Now, which are the cancers in which we do screening? One is breast cancer, cervical cancer commonly. Unfortunately for ovarian cancer, screening is not been recommended, or screening is not useful. We do a blood test called CA125, which is elevated in ovarian cancers, and we do an ultrasound when patients have ovarian cancer. None of these two tests are recommended as a routine screening. So you cannot say that, let us start doing CA125 for all women above 40 years to detect ovarian cancer. Your chances of detecting are very, very less. You'll be testing a lot of women and unnecessarily subjecting them to testing and obviously financial issues too. Same way with an ultrasound. Also, please remember, a CA125 can be normal in 30% of ovarian cancers, number one. Number two, CA125 can be increased in lot of non-cancerous conditions also, like maybe pregnancy, it can be increased in menstruation. During menstruation, it can go up. It can increase during endometriosis, adenomyosis. These are all non-cancerous conditions. So it is not a foolproof test. It is sometimes normal in cancer also. So it is not an effective screening test. So is an ultrasound. But in families or in people who are positive for this mutation, you can probably advocate the screening at a bit earlier age, that is 5 years or 10 years compared to the person. So somebody in the family has had ovarian cancer at 50 and they have a genetic mutation and you also carry the genetic mutation. Maybe you can start screening once a year or once every 6 months from the age of 50 minus 5, that is 45 or 40 years. So it is not a routine philosophy for the general population, but yes, you can tailor it to a very specific group of people who have family history.
Thank you, doctor. Thank you for addressing the question. When we move on to the next question, what is ovarian cyst and is there any relation with the cancer? Is there any, if there is any cyst detected in a patient, do we need to suspect it as a cancer?
So cyst is basically a fluid filled mass. Okay. So that is how, so a cyst is commonly seen in an ultrasound. So many women come with simple cyst. Simple cyst is, it is just fluid. Then there is something called a complex cyst. Complex cyst means it is having the part of fluid and part of solid part also within the mass or in the cyst. So a simple cyst is okay, but any cyst which is more than 5 centimeters in a lady who is post-menopausal, that is after she completes her regular menstrual cycles, or a complex cyst, or a cyst which on we do something called a Doppler ultrasound, which has a lot of vascularity or blood supply. So these are the 3 types of cysts where we should be suspicious. We should have we should be aware that are we probably dealing with an ovarian cancer. So a simple cyst, which is 2-3 centimeters in a post-menopausal lady, we need not worry. A 8 centimeter cyst, a complex cyst, which has both solid and cystic parts on ultrasound and on Doppler, which the radiologist will tell you, which looks suspicious. And if you supplement it with a CA-125, which is sky high, which is in hundreds, then I'm not going to say that it is definitely a cancer, but it should raise the suspicion of cancer.
Thank you, doctor. Thank you for enlightening on that. And the next question is that what are the signs and symptoms of ovarian cancer? Because any cancer, there is a big saying, if you detect early, you can save your life. And the the patient survival will be much better if you detect early. So to detect it early, so what are the basic signs and symptoms we need to be cautious?
So the symptoms and signs of ovarian cancer are unfortunately very vague. Unlike a breast cancer, which presents like a breast lump, which a lady can identify during examination, ovarian cancers unfortunately have very vague symptoms. Patients may have pelvic pain, they may have abdominal pain, they may have bloating, they have a sensation of fullness in the tummy. They may say that after a few morsels of food intake, we feel full, and then there is weight loss. There is bleeding from the vagina. There may be swelling in the lower limbs. So these are all, and constipation. So these are all some of the symptoms, but none of these symptoms are specific. For example, constipation can be seen in ordinary gastrointestinal issues also, even gastrointestinal cancer, like intestinal cancer also. So, but to summarize, pelvic pain, abdominal pain, bloating, early satiety, that is, you eat a little bit and you feel full, and fluid in the legs, accumulation in the legs, and then constipation. These are all some of the symptoms of ovarian cancer. So woman above 50, if she has these symptoms and her appetite is going down, she's also having weight loss, and then it's better she gets herself checked by a physician once.
Thank you, doctor. So basically they need to care about every symptom they receive because they should not neglect anything. Because in the beginning, as we discussed, it's a silent killer because every sign and symptom, it may not be ovarian cancer, but there may be a chance of ovarian cancer. Is that correct, right?
Yes, but again, see, these are all very vague symptoms. So at the drop of a hat, we should not immediately get scared and go and scan ourselves and do a battery of tests. If these symptoms are there for a long duration, they are not improving after your regular medications, maybe antibiotics or conservative management, they would probably be seeing a doctor and try some medicines. And if it is not improving, it is getting worse. One after the other, the symptoms are adding up. You're losing weight, you're losing appetite. Then it's a cause of concern. But just that since yesterday, if I'm having mild bloating and I have constipation for a couple of days, that doesn't mean that somebody has ovarian cancer. So the whole idea is not to scare people here. These are all very vague symptoms, but be aware that if these are present for a longer period of time, there could be some other problems to get yourself evaluated.
But once we have anybody history of ovarian cancer in our family, it's always better to keep a watch on it and be cautious, right, sir?
Definitely.
Thank you, doctor. Thank you very much. Sir, my next question is that, are there any different types of ovarian cancers altogether?
So that is what we discussed just now. So broadly, epithelial ovarian cancer and germ cell tumor. In epithelial, a pathologist or an oncologist will sit and tell you that there is something called a serous type, there is a clear cell type. So there are different subtypes. But for the lay people, not to confuse people, there is a good type of ovarian cancer seen in young people called germ cell tumor, and the common one, which is the epithelial ovarian cancer, which is unfortunately an aggressive variant, which is usually seen in elderly women. That is what we should try to remember.
Thank you, doctor. Thank you very much. Doctor, next question is that, how to suspect and detect ovarian cancer early?
So as we just discussed now, somebody has these vague symptoms for a longer period of time, then the first thing obviously which will be done is a physical examination. We will examine the patient. We will try to see if they have any lymph nodes in the neck. We will examine the tummy to see if there is any lump in the tummy. If there is any water in the tummy, which is called ascites or fluid rather, we would send that for testing. And these patients would have a blood test called CA-125, which is elevated in almost 60 to 80% of ovarian cancers. And they will get scanned in the form of an ultrasound or a CT or an MRI of the abdomen, which will give us a clearer picture whether there is a mass in the ovary, whether there's a cyst, is it a complex cyst, is there fluid, has it spread to adjacent organs, etc. So the series of steps when somebody is suspecting a patient with ovarian cancer is physical examination, biochemical tests or blood tests in the form of CA-125, and imaging in the form of either an ultrasound or a CT or MRI, and testing the fluid which is there in the tummy for analysis, or which is called cytology.
Thank you, doctor. Doctor, in your real-time practice, out of 10 ovarian cancer patients, how many are detected in the advanced stage?
So worldwide, 60 to 80% of the patients are detected either in stage 3 or stage 4. This is a worldwide number. There is no difference in east west because unfortunately, as we just discussed, there is no effective screening method. So by the time somebody presents with bloating or fluid in the tummy, they're already stage 3C. So most patients present in an advanced stage. Very rarely do you have somebody who has gone for a master health checkup and they pick up some cyst in the ovary and they are very proactive and they get evaluated, and then you detect an ovarian cancer. But this is very, very early ovarian cancer, and then you go ahead. But otherwise, most of the time, by the time you detect an ovarian cancer, it's either stage 3 or stage 4.
Sir, there is a question from Mr. Naveen Chari asking, does ovarian cancer cause death? That is his question.
Does ovarian cancer cause death?
Yes, sir.
Any cancer, if untreated, can lead to death, and definitely even ovarian cancer. And the unfortunate part of ovarian cancer is, despite treatment, despite all kinds of treatment which you can offer to a patient, again, 60 to 70% of them can recur. And when they recur, they are not curable usually. And ultimately, in a few years, it would lead to the demise of a patient or death of a patient. So yes, untreated ovarian cancers or recurrent ovarian cancers for sure can be fatal.
Thank you, doctor. Sir, my intention behind this question was, like, if you see the remote areas are tied to cities where you have limited access to HRCT or any other high-end technology for diagnosis. So there, by the time they reach to the oncologist, as you rightly said, they must be in the stage 3 or any other advanced stage. So what is your suggestion for the people who are in the tier 2 cities or in the below village or remote areas?
No. So by the time you develop symptoms itself, unfortunately, you are having a stage 3 disease. There is no, most of the time. So it doesn't depend whether you're in a tier 2 city or you're living in Mumbai or you're living in Hyderabad. By the time someone develops symptoms. So the whole point here is to educate people that they have to be cautious about symptoms. not to scare people, but to educate people, saying that if you have any of the symptoms which we discussed above for a longer period, maybe 2 weeks, 4 weeks, or whatever, go consult your doctor. Get yourself evaluated once. If everything is fine, well and good. If no, at least you know there is an issue and you're going forward. It doesn't depend whether you're in a tier 2 city or a tier 3 city. It is not related to access to healthcare. It is purely related to the biology of the disease, which unfortunately, by the time symptoms develop, the patient has a stage 3 disease.
Thank you, doctor. It's not about the access, it's about your disease. Like the disease biology is like that.
Okay. But once you are diagnosed, wherever you are in a tier 2 or a tier 3 city, go and see an oncologist as soon as possible so that you have that access to healthcare, and the planned treatment as per protocol starts off as soon as possible.
Thank you, doctor. Thank you very much. Sir, in our Indian scenario, at what age women need surveillance on this gynecological cancer, particularly ovarian cancer? At what age they need to keep surveillance?
Again, as we discussed, there is no screening or surveillance for ovarian cancer per se. But when you also, since you mentioned about gynec cancer, I'll take this opportunity to educate or to make people aware that cervical cancer is a very common gynec cancer, and women should have a pap smear done at least from the age of 21 years, once every 3 years, and if possible, even a HPV testing once every 5 years. So that apart, that though that is not the subject of today's discussion, for ovarian cancer per se, there is no surveillance, though there are multiple labs or hospitals who do CA-125 as a part of the master health checkup. Not wrong to get it done, but don't get worried the minute you see if 35 is the normal value, less than 35. If it is 37, don't get worried. CA-125 can go up in benign conditions, normal conditions. And if you have 10 and you have all the symptoms, doesn't mean you don't have ovarian cancer. So we have to take the tests with a pinch of salt.
Thank you, doctor. Doctor, in ovarian cancer, are there any benign cancers that doesn't spread to any other part of the body?
So benign per se means it is not cancerous. It doesn't have the tendency to spread. So in our language, we call it maybe a cystadenoma, those kind of terminologies. So benign cancers are usually resected, and then you don't need any treatment after that. And the risk of spread is nil.
Thank you, doctor. Sir, there is a question from the audience. What treatment options are available for ovarian cancer, and how do doctors decide which treatment is best for patient?
So broadly, to keep things very simple, the treatment options for ovarian cancer are: number 1, surgery; number 2, chemotherapy; number 3 is targeted therapy, where we try to stop the blood vessels from growing in the cancer; and number 4 is, as we discussed about BRCA positive patients who have mutations, we use certain medicines called PARP inhibitors, or the names of those medicines are olaparib, rucaparib, etc. So surgery, chemotherapy, PARP inhibitors, and targeted therapy. Since most patients present with an advanced stage, that is stage 3, we usually give chemo first, shrink the disease, and then take up for surgery. Those patients who are BRCA positive, they receive BRCA medicines in the form of PARP inhibitors. And in advanced cases, or in the recurrent setting, when the disease comes back again, you give chemotherapy plus targeted therapy. This is a very simplistic way of putting things. We can go much deeper, but it will become too complicated for the common man. So surgery always is the most important thing. If we can do a surgery, we should always do a surgery. Most of the time, the surgeon will probably tell you, you have stage 3 disease. So go get chemo first, shrink the disease, come back to me, get the surgery, and then you may need some more chemo. Or if the disease comes back again, then usually surgery is not possible. You get chemotherapy with targeted therapy. And if we are BRCA positive, olaparib, which is PARP inhibitors.
Thank you, doctor. Doctor, generally, when a woman faced any kind of signs and symptoms, they first reach to the general physician, or in the next level, they reach to the gynecologist. Do you suggest our audience what questions exactly to ask a gynecologist, or when to suspect it as a cancer?
So when they meet a physician or the gynecologist, for sure the gynecologist or the physician will evaluate them with CA-125, ultrasounds, and all that. And once the minute they feel this is something which is cancerous, they would advise that they should probably get a surgery or see an oncologist. And so it is that particular time where the patients or caregiver should not, or the family should not waste too much time and approach someone who is dealing with cancer, be it a surgical oncologist or a medical oncologist, and go ahead with the process. Where the first thing is maybe you need to get a biopsy done from the omentum or from the area where it has spread. And once it is confirmed, then you should sit with your surgeon and the medical oncologist, have a multidisciplinary plan where all of them sit together and decide, I'm going to give chemo first or I'm going to do surgery first. That everyone has to sit and explain the patient and the family. And once everybody is on board, these decisions have to be taken quickly.
Thank you, Doctor. Thank you very much. Doctor, there is a question from YouTube channel, YouTube ID name World Views. Okay, can a 30 years old woman get ovarian cancer?
So cancer unfortunately has no rules. So though I told you that increasing age is a risk factor for ovarian cancer is also seen in young women. We do see it. More so commonly, if it is such a young age, you will probably think of somebody who's having a hereditary mutation like a BRCA1 or BRCA2. So yes, it is very much possible, but in a young patient with ovarian tumor, think of a germ cell tumor first, but ovarian cancers are not uncommon.
Thank you, Doctor. Sir, in today's scenario, PCOS is one common problem observed in the young women and middle-aged women also. So is there any relation between the PCOS and as well as ovarian cancer?
Polycystic ovarian disease, there is conflicting data, but because there is a whole hormonal milieu which is there, they are put on hormonal medications. So the cause and effect relationship is not very, very clear.
Thank you, Doctor. Doctor, how to prevent ovarian cancer? What is your suggestion for us?
So prevention for the general public is just that be aware of the symptoms. But suppose you have a family member, your mother or sister who's having a BRCA positive disease and you yourself are BRCA positive, there are 2-3 things you can do. So I'll give you a story like a scenario. So suppose somebody's mother has BRCA in the blood, BRCA positive, and she has ovarian or breast cancer, and because of which you are also tested for BRCA. So another lady, this daughter has been tested for BRCA and she's positive for BRCA. So she has a risk of breast and ovarian cancer. So for ovarian cancer, what you will tell her is remove both your ovaries. This is called risk reduction, risk reducing salpingo-oophorectomy. Salpinx is your fallopian tube, oophorectomy is your ovary. So we tell them risk reducing surgery in the form of ovary and fallopian tube removal is advised. Okay, but you please remember, ovary is a reproductive organ, so that is necessary for childbirth. So for this girl, what you would tell you is once you are 35 or 40, once you are married, once you have completed your family of 2 children or 3 children or whatever, that time, because you are BRCA positive, you have a risk of ovarian cancer. Now you have completed your family. What we'll do is we'll remove your ovaries and fallopian tube so that the risk comes down. Okay, so that is one thing which you will. So that is the only risk reducing strategy for ovarian cancer, and that is especially in these kind of population. Otherwise, for the general public, you are not going to suggest any surgeries or any medications to reduce the risk of ovarian cancer. They should just be aware.
Sir, there is a question from Leslie Albert. Are there any complementary therapies or lifestyle changes that might help with the treatment side effects?
So by treatment, as we said, there are 3 kinds of treatments. If you keep the surgery aside, one is chemotherapy, one is targeted therapy, and one is your PARP inhibitors. Coming to chemo, which is the most common. So with chemo, you lose your hair, loss of taste, you cannot tolerate food, even ordinary food feels very spicy, and you have a vomiting sensation, nausea, weakness, and all those kind of sensations, problems. What we usually tell our patients is, you will be, let's also understand that in today's modern era, we have excellent medicines to prevent vomiting and infections and to prevent fall in WBC counts in our patients. So that is not a worry at all. So your complementary therapies are going to be first, be positive, number 1. Number 2, preferably eat home cooked food, avoid outside food, outside junk food. Take small quantities multiple times a day. That is what we tell our patients. Have more fiber in the diet. because ovarian cancer can affect your bowel, because what happens is there can be small deposits over the bowel which can lead to constipation. So what you want is, you don't want to land up with constipation. So drink lots of water, take lots of juices, green veggies, fruits, fruit juices, have high fiber in the diet, so that you have a good bowel motion. You should not be constipated for 2-3 days and then that pain increases and that adds up to your suffering. And then any other techniques in the form of yoga or a small walk for 15-20 minutes a day. So these are all the things which we usually tell our patients. The most important thing will be to continue your vomiting medicines for 3-4 days after your chemo, to take your booster shots, which we call growth colony stimulating factors, granulocyte colony stimulating factors. This is to increase your WBC count and prevent infection. So apart from changes in diet, vomiting medications, antiemetics, colony stimulating factors to prevent infections, and more importantly, a healthy, motivated mind. Just be positive and things will fall in place.
Yes, doctor. Got it. And there is a next question from Mr. Lokesh Reddy. What is the prognosis for ovarian cancer, and how does the stage at diagnosis affect outcomes?
So prognosis for ovarian cancer, as Mr. Lokesh asked, is exactly based on the stage. So stage 1, the prognosis, in cancer, we talk about something called 5-year survival. So your 5-year survival comes down from close to 90% to 30% from stage 1 to stage 4. So for the common stages, which is stage 3 and stage 4, your 5-year survivals are somewhere like 40% or 30%. So the higher the stage, the poorer the prognosis, the lesser the 5-year survival. And unfortunately, we see these patients in the higher stage only.
So early detection, it can prolong the survival rate.
But for that early detection, you should be literally asymptomatic, and unfortunately, there is no screening available too.
Doctor, in women wellness or women healthcare, generally, if there is a gynecological issue, they go for a scanning, basically ultrasound scanning. So what are the probability of detecting ovarian cancer in those regular scannings, or the scannings which are not intended for cancer screening?
So see, number one, a scan is a photograph, so it will not accurately tell you whether you have a cancer or not, number one. Number two, as we discussed, many times you detect a cyst which cannot be a cancer. Only a complex cyst or a large cyst could be indicative of cancer. So even though we detect, so this is by no means to tell people that go and get yourself scanned every month. I'm not trying to say that, but if you get a scan done and if something is picked up which is suspicious, go and see your doctor. Otherwise, it makes no meaning to get a scan done every 6 months or every 1 month.
Because generally in the lower abdominal pain or a side partial pain that felt in the woman, they consult a gynecologist and
they are all very non-specific symptoms, unfortunately, because of many other conditions. And ovarian cancer should not be first in the list for those kind of things. We should think of common things rather than ovarian cancer.
Yes, doctor. Doctor, is there any vaccine to prevent ovarian cancer? Because we heard there's a vaccine for cervical cancer. So likewise, are there any vaccines?
Vaccine for ovarian cancer. We do have a vaccine for cervical cancer, which is for boys and girls between the ages of 9 to 13, preferably. Not only for cervical, it helps in preventing anal cancer, vaginal cancer, vulval cancer, oropharyngeal cancer, etc. But for ovarian cancer, we don't have a vaccine.
Thank you, doctor. Doctor, because ovarian cancer, it happens in the one ovary. Is there any chances of spreading into the next ovary also?
Yes. So that is how the staging is also done. So ovarian cancer can start in an ovary, it can spread to the fallopian tube, go to the other ovary, involve the pelvic structures, go beyond the pelvis, spread to the other organs, form water or fluid in the tummy, go to the liver, can go to the brain also sometimes, lungs. So like any other cancer, ovarian cancer too has a tendency to spread not only in the reproductive organs, outside the pelvis also, in the abdomen and also beyond.
So what are the other organs where there is a possibility of spreading of this ovarian cancer?
Brain, lung, liver and abdomen commonly.
Commonly, any other organ of the body, it is capable of spreading. Thank you, doctor. Doctor, is it a hereditary? Of course, you have already answered this question. Yes. Like if there is a BRCA mutation in the familial history, or if anybody diagnosed with a cancer in their history, and they should be cautious. So any other suggestions for this hereditary follow-up?
So BRCA1, BRCA2, and Lynch syndrome are two common mutations where there is a hereditary risk of ovarian cancer.
Doctor, for the benefit of our understanding, can you please little brief about what are the stages of ovarian cancer? How do you stage them?
So staging is what do you say? It's a clinical staging or a surgical staged disease. So for laymen, it is not your common stage 1, stage 2, stage 3, stage 4. It's a completely medical and a surgically staged disease to see where it has started. Is it limited to an ovary? Has it gone to the fallopian tube? Is it gone to the pelvic structures, or is it gone beyond that? So keep it very simple. If it is limited to the ovary, it is 1. If it goes to the fallopian tube, it is 2. If it is in the pelvis, or if there is water in the fluid in the abdomen, it is stage 3. And if it goes to other organs, it is stage 4. If it splits to distant organs, it is stage 4. To put it very, very simply.
Doctor, are there any possibilities of getting any other cancer along with the ovarian cancers? Simultaneously occurring cancers?
So simultaneously, people can get sometimes breast and ovarian cancer. They can have ovarian and uterine cancer. We see that. So it is not unheard of. You definitely can get, and those patients probably will be harboring some kind of mutations.
So there is a possibility of a woman diagnosed with the 2 cancers at a time also.
Yes, those are called synchronous malignancies. So I can get 2 cancers at the same time today. That is called synchronous. That is, today itself I'm diagnosed with 2 different. We have patients who have breast cancer and lung cancer. That is not due to any mutation, but unfortunately that lady has breast and lung cancer. Now you may have breast cancer today and 15 years later develop a lung cancer or a leukemia or something else, or a sarcoma or a bone tumor. So those are called metachronous malignancies. That is, one cancer many years back, another cancer after that, not together or diagnosed at the same time. There is a gap between the two.
Doctor, in generally, when cancer is detected in any person, it is not only the patient, it also bothers the entire family, let it be emotionally, let it be financially, or anything. But as you rightly said, if the cancer is detected early, not only ovarian cancer, any cancer, if it is detected early, survival chances are better and the treatment prognosis is also better. Am I correct, doctor?
Definitely. So cancer is always curable if detected early. That's the whole motive. So we have to understand in general that cancer is preventable. Use screening methods appropriately for the appropriate type of cancer. Avoid, have a rather a healthy lifestyle. And the most important thing is cancer is for sure curable if detected early. That's the message which should go down to the layman.
And the last question, doctor, here, like if anybody detected the cancer, the first question will be from the patient mind is how long I'll survive. That is a one question, not only ovarian cancer, any cancer you take, any detection of a cancer related, how long do I survive? Because everybody have a emotional responsibilities or family responsibilities, financial responsibility. They wanted to accomplish everything and they want to complete their role and responsibilities in the family also. So in general, doctor, in general cancer, how do you suggest our audience this survival related?
So there are 2 ways I will answer your question. One, which I commonly discuss with most people, is let us not play God. Let us not play God and say that I am going to live for 3 months, you are going to live for 6 months, etc. So that is number 1. Number 2, go scientifically. Now, when we spoke about ovarian cancer, we spoke about 5-year survival. And the general 5-year survival for maybe a stage 3 or stage 4 is 30% or 40%. That doesn't mean that that statistic should apply for every individual the same way. This is an average. Statistics or data is always an average. You may be in this 30%, you may be in that 70% also. But what we should understand is, have we been detected early? Is our stage early? Have we had the right treatment at the right possible time? Have we recovered well? Then our survival chances are much higher. Let us not try to put somebody in one basket saying that this fellow will live for 3 months, this fellow will live for 6 months, this fellow will live for 1 year. But yes, certain things have to be very clear whether we are treating for curing the patient. Sometimes the disease keeps coming back 3 times, 4 times. Then you're going to say, I cannot cure you. My aim is to only palliate. That is to give you a good quality of life, to control your symptoms. Okay. and I may not be able to cure you, but to control your pain and to prolong your life. That could be maybe 6 months, maybe 1 year, maybe 1.5 years. You cannot pinpoint on a particular thing, because you may be fine, you can have a heart attack and you may die, or the disease itself may take its toll later. So the bottom line is early stages are curable. Early stages have better survival. Advanced stages usually recur. If they recur, they are generally not curable and they have a poorer survival. There's one question I'm seeing here.
Yes, sir.
Somebody is asking me whether there are any emerging therapies or clinical trials for advanced or recurrent ovarian cancer. So what we discuss now is all part of the evolution in cancer therapy. So 15 years back, we were not testing so much for BRCA, or we call it HRR testing, and we didn't have medicines for BRCA. Now we have identified there is a mutation which runs in the families, whom you have to identify. Giving this particular medicine called PARP inhibitor helps these kind of patients, and these patients do well for a long period of time. And so these are all the positive steps in the treatments of ovarian cancer, including surgical techniques, and be it also a particular type of treatment called HIPEC. And because I'm a medical oncologist, I will talk more about PARP inhibitors and the role of BRCA testing. And there is more work being done. We know that this is not enough. World over, clinical trials are going on, and immunotherapy is also used, not that commonly in ovarian cancer, but in certain subsets. So these are all the positive steps in the direction of ovarian cancer.
Thank you, Doctor. Doctor, in generally, in a cancer treatment, people have a belief that, sorry, not in the treatment, it is in the diagnosis part. When doctor wanted to collect a biopsy, patient have a myth in their mind that if I give a biopsy, my disease will spread. Is that true, doctor?
So biopsy is essential for diagnosis. So tissue is the issue. Okay, but when you talk about an ovarian cancer, if it is it's a ovarian tumor, you would not want to puncture it because you may upstage the disease. The cells may spill out. So that is one condition where you will not want to do a biopsy. But if the disease has already spread to other areas like liver or omentum or anywhere, you will do a biopsy from there. So we need a biopsy. There is no running away from that. You will do a biopsy from any area apart from the ovary, because if you puncture the ovary, you may upstage the disease. Since most of the time this disease spreads to other areas like omentum or the fluid in the abdominal cavity or the liver or the liver surface, we biopsy that very easily.
Understood. So there is a question from Sirini Rajender. Can ovarian cancer occur in younger women?
I think we answered that question. Yes, ovarian cancer can occur in younger women, usually in mutation carriers. But also remember that could be a good variety of ovarian tumor called germ cell tumor, which we should first think. If that is ruled out, then the biopsy, CA-125 and other blood tests like tumor markers will help.
And doctor, in cancer treatment, there is a hair fall happens. So that is a big concern for a woman. So why this hair fall happens in a cancer treatment, but do that hair fall stop and will the hair come back as a normal? Is it possible?
So cancer cells, so chemotherapy always affects the dividing cells or fast growing cells. So the dividing cells are the scalp hair or the tongue, the taste cells, these are all destroyed first. But once you stop chemotherapy, they come back. When they come back, they may not be in the same texture as or the quality of your initial hair, but they definitely come back.
Because this is a common observation for any woman undergoing the treatment of breast cancer or any other cancer. After the chemotherapy, they observe the hair fall, heavy hair fall. So there's a chances of
usually starts for 15 days, second week or third week of the first cycle, and by second or the third cycle, they almost have a patchy loss of hair or a complete loss of hair.
Thank you, doctor. And doctor, chemotherapy is a term it is used very commonly in the cancer treatment. What exactly this chemotherapy? Can you please enlighten us?
Basically, it's a drug to kill cancer or to control cancer. Like an antibiotic is used for bacterial infection, chemotherapy means a drug which is given for cancer treatment, either to kill the cancer cell or control the cancer cell. It can be oral, it can be IV, It can be given in the spinal cord also in certain kinds of cancers. It differs in the way of administration. So drug to control or kill the cancer cell is simply called chemotherapy in layman terms.
Thank you, doctor. There is a question from Enugu Mahesh. What support and resources are available for ovarian cancer patients in India?
So basically the support and so one is support as regards knowledge and awareness and education, where you have a lot of literature available in the net. Preferably there are books being circulated by leading organizations, leading hospitals of our country, or there are good websites which have good information on ovarian cancer. So that is freely available on the net. That is not an issue. With regard to support, there are support groups of patients also, survivors also, who have WhatsApp groups, who have Telegram groups, where they complement each other, they support each other with regard to educating the fellow patients on what they have gone through. So these support systems are available. Be it regards enlightening yourself or having support from earlier patients, and obviously your doctor is there, your staff nurses are there. They can probably give you resources and numbers of their past patients who will have more of an impact on you. It can help you navigate through that journey of treatment.
Thank you, doctor. In cancer treatment, because generally when we approach to the oncologist, they recommend treatment to us. But after going to home, when the patient is on the treatment, are there any common precautions or any cautions they need to take at their home during the treatment?
So we usually ask, so patients should maintain a very good hygiene. They should avoid contact with a large number of people at home. They should eat fresh cooked meals, small quantities multiple times a day, drink lots of liquids. If there are no restrictions, fruits, juices, and green vegetables, fiber in the diet, minimal regular exercise, 15-20 minutes a day, whatever they can do. Gargle well to prevent mouth ulcers. Avoid constipation, because that can also lead to hemorrhoids or piles or fissures. If needed, your doctor will prescribe a laxative. So these are all the little things. And some kind of an alternative complementary therapy in the form of a yoga or some good amount of music, spending time with friends, just to complement yourself. So it's a mix and match of everything. Medical treatment given at home, post chemotherapy by a doctor, complementary therapies, and more importantly, diet and nutrition.
Are there any alarming situations when they need to return back to the doctor immediately, like during the course of follow-up treatment?
Yes. So if you're having high grade fever above 101, which is persisting, if you're very weak, dehydrated, vomiting, have large amount of loose motions or loose stools, vitals are all bad in the form of you have low blood pressure, high heart rate, you're not feeling well basically. So if you feel you are not well, you are not eating, you feel, if you are having high grade fever, you are consistently vomiting, you feel breathless, you have loose motions, then you should go and visit your doctor immediately, especially if you have taken chemotherapy and you have all these symptoms.
Doctor, there is a question from Mr. Arjun. Is there possible to conceive after treatment of ovarian cancer?
So the whole problem is, see, if you have ovarian cancer, your ovaries are going to be removed. So surgery is one of the most important things in ovarian cancer. So if you do a good surgery, is extremely essential for an ovarian cancer patient to maximize the chance of cure. So when you are going to do a surgery, you're going to remove both ovaries. This is called a complete surgery, complete cytoreduction we call. So for a complete surgery and to have the best possible chance of cure, you have to remove my ovaries and uterus and fallopian tubes. And that is going to be done. The patient obviously can't conceive. There are certain situations, it's a young lady, you have one ovarian tumor, so where you will compromise the surgical technique and preserve one ovary and the uterus. This is to give a chance for that patient to conceive, because she's a young woman, she has ovarian cancer, but you cannot remove the ovaries and uterus also because she has to conceive also. So that's a very catch-22 situation where sometimes an optimal surgery may not be done and we leave behind the uterus in one ovary. But usually in an ovarian cancer, if surgery is being done, all these areas are all these organs are removed, and obviously then uh, conceiving would not be possible.
Understood. Doctor, when come to the lifestyle in the modern era, how this alcohol or smoking that is impacting overall human health and especially related to the ovarian cancer. Any suggestions on this?
So a simple rule is smoking alcohol for both men and women is wrong. I'm not going to say it's right or wrong. It is bad for health. That's all. So smoking is bad. Alcohol consumption is bad. Though people say moderate alcohol consumption may be good for the heart, but from a cancer point of view, smoking and alcohol both are for sure not good for your health. Smoking especially because it can cause a variety of cancers, right from your head and neck cancers down to stomach and all kinds of cancers. So smoking, tobacco chewing, alcohol are it is better that the people do not indulge, be it both men or women.
Understood. And doctor, this question looks very silly, but I heard it from many people. Is cancer is contagious?
No.
Definitely, because some people when they are assisting their fellow patients or their family members, they have a fear saying that it may be a contagious. I may get the cancer. Those kind of some
No.
myths are there. Some kind of, so definitely it is not a contagious
No.
disease. So it is limited to the person where it is occurred. Thank you, doctor. So thank you very much for accommodating all our doubts and questions, and thanks for your patience to enlightening us in the complete knowledge on this. We thank you very much for attending this live session with us.
Thank
Thanks a
you.
lot, doctor.
Extremely grateful, and thanks to all our participants who have asked important questions. And I hope we have tried to cover some basic things on ovarian cancer and enlighten people. Thank you so much.
Thank you, doctor. And in the next coming session, we will be discussing more on the treatment part of it and diagnosis part of it and cope up with the cancer and any other leftover questions from our audience. Definitely we'll come back to you on this. So hopefully another 10 days, we'll catch back again, doctor.
Thank you.
Thank you very much. Thanks for your patience to address all our questions. Thank you.